Good evening, everyone. My name is Todd Young, and I will be presenting on behalf of Lori Axworthy and myself. I want you to imagine for a minute that you are a worker on a hydroelectric line 250 to 300 kilometers from the nearest highway or healthcare facility, and you become injured. There is first aid available, but there's some complexities with regards to triaging and determining what level of care you need, but also the timeliness of that assessment and the potential injuries that could result as a part of delayed assessment. We would like to introduce you to ConnecX. ConnecX is our marketing plan strategy, which is a new software platform that will link remote workers to healthcare. Technology is currently changing the way people view and perceive health, as well as how they choose to use healthcare services. Consumers today are enlightened and already tech savvy, enabling them to adopt and embrace technologies very easily. The economies of the industry, as well as the need for healthcare solutions, makes the market wide open and lucrative for innovation. Technology has helped to increase the accessibility of healthcare across populations, genders, and age groups. The worker employed in rural or remote areas are the major target of ConnecX. Employers are challenged with cost of transportation to medical care, even for minor ailments, and the associated lost time for workers and associated costs in workers' compensation, claims, etc. Newfoundland's economy is a natural resource-based economy, and thousands of workers are employed in offshore oil and gas, mining, forestry, and hydroelectric industries. Embracing technology may therefore be the much needed solution to the growing cost of healthcare for occupational health employees. The market is therefore large and is expected to continue to grow. Through our analysis, we found many strengths, weaknesses, and certainly there were opportunities and there were some possible threats as well. The strengths, of course, was that it would be convenient, innovative, it would be able to begin from the ground up, be able to build a reputation, build excellence. There were opportunities for certainly marketing within society just in general about these telemedicine services. Medical practitioners, they're certainly in a climate now where they are becoming more open to using telemedicine as a service as long as it meets the privacy standards. But there are, certain weaknesses, including the absence of a financial structure, the absence of work systems regarding the capture and transmission of data process, the lack of experiences in the telemedicine industry, gaps in capacity or service areas. And there are certain threats. There is a limited national technology infrastructure. Cyber threats is certainly a reality when it comes to data breaches, and competitors have superior distribution systems and financial resources, the possibility of reforms in reimbursement. The main target for the product included the occupational worker, as stated, in rural and remote areas. The connection provided will therefore increase accessibility, improve timely triage and access to health care, and expectedly would change the outcomes of health care. Injuries, occupational health injuries, all this is a focus at reducing the burden of illness and the economic burden within industry as we try to solve healthcare costs. The appeal that ConnecX has will help move close to a clientele that finds excellent value in technology, and through its product offering customers or consumers they will be able to use the platform frequently to create a powerful online community, focusing on the less accessible occupational health worker will also increase the market perception and reputation score. Nevertheless, the critical issues are to continue taking a modest monetary approach to the company's operations while also developing a brand awareness that will compel customers to consider the product. The main idea behind this strategy is to improve the relevance of the product in a market that is scantily explored. The specific objectives, therefore, revolve around connecting the service providers to the service users who are at the point of need. The product focuses to achieve this in the lowest cost and minimal disturbance to the societal balances. The uniqueness of the strategy is aimed at giving ConnecX a competitive edge in the market. Despite being a growing and improving concept in health, telemedicine is quite competitive. A provider who will be in a position to resonate effectively with the needs of a target group and communicate with them and offer services that will be affordable to them will win their hearts for sure, particularly when it's related to employees, when they know that they're getting timely care, but employers when they know that they are also saving money. From the financial perspectives and statistics, ConnecX seems like a profitable idea whose development will change the face of healthcare for the occupational health worker employed in a rural or remote part of Newfoundland in this particular case. This venture with the projected profits is likely to be a game changer in the industry and provide a competitive force to the rest of the providers. Such a competition will help the sector to grow and improve. So just going back to what we had talked about at the beginning, imagine that you are a worker in a remote area. You know, ConnecX can give you timely access to a physician or nurse practitioner, can give you timely assessment with the adjunct of a first aid provider or a medic or some other healthcare profession who would be employed with industry. It could save costs with transportation and avoid accessing unnecessary health assessments, which often require either road or air transfer and often require many days off work just to access care. But we all know that once an injured worker presents to the emergency room, it is also highly probable and likely that they will be put off for an extended period of time. ConnecX will change this. ConnecX, I would suggest, will connect the physician and nurse practitioner to the worker, and within very quickly through triage and effective communication, a large percentage of people will not even need to access care, but rather will be given initial information to manage their injury, and timely follow-up can be provided even in subsequent days using ConnecX as well. Thank you for your attention, and I hope that you found that this software platform will be an interesting adjunct to occupational health services, no matter where industry is working. Thank you for your attention.